Good morning, everybody. Can I thank everybody for their patience and thank again nearly 42,000 people that came forward for testing yesterday. It was again an unbelievably high number. We're deeply grateful that people not only are listening to the restrictions in place, not only adhering to the advice we're providing, but they're also coming out in droves to get tested, and that's exactly what we need during the course of the next few days and the next few weeks. Overnight, we had 8 cases of local community transmission. 7 are directly linked to the Avalon cluster. The 8th case is the one that was referred to yesterday, which was a direct contact of that person who worked in transporting people to hotel quarantine. So 7 directly linked to the Avalon cluster, and the 8th case is the one that was already mentioned yesterday, which Dr. Chand had provided details for. Over the next few days, there will be modest changes to restrictions over the Christmas period. We appreciate what a difficult time this is for everybody across the state. In particular, our thoughts are with those who are already in isolation, because as we know, when you're in isolation, you can't have contact with anybody for 14 days, depending on when you started that isolation. So our thoughts are with those people who will be in isolation over the Christmas period. In relation to regional New South Wales, there will be no changes. In relation to Greater Sydney, there will be no changes but for one tweak, and that is on the 24th, the 25th and the 26th. You can have, of course, 10 people into your home, but you'll be able to have, in addition to that, children under 12. So on the 24th, the 25th and the 26th, if you're in Greater Sydney, you'll be able to have 10 people in your home, which is what you currently can have, but you can add kids under 12 onto that. So 10 adults and kids under 12 would be allowed in any single household. But can I stress, you cannot have different groups of 10 people during the day. It's one group of 10, and you have to stick to that one group of 10 plus kids under 12. So please make sure that it's only one group you have to your house in Greater Sydney. You can't mix groups. You can't have different rosters on. You can't say to half the extended family come in the morning and the other half come in the evening. Not possible. On any given day, you have to have the same group of 10 plus kids, and that's the difference. Now, after that period, on the 27th of December, for Greater Sydney, we revert back to just 10, including children, right? So the 24, 25, 26 allows kids under 12 on top of that number. But come the 27th of December for Greater Sydney, we all go back to just 10 per household, full stop. So every other restriction remains in place, but for that addition over the Christmas period. In relation to the northern beaches, both the science and the health advice tells us that there are 2 distinct parts of the northern beaches, and we will be separating those areas geographically. So clearly the concentration of cases, the epicentre of the cluster is in the northern part of the northern beaches. So there will be now a new boundary at the Narrabeen Bridge, which is a locals, as Minister Hazzard would know, is an obvious location for locals. And the western boundary will be near the Baha Temple at Monavar Road, which again to locals is a very distinguishable boundary. Now, if you are a resident of the northern part of the northern beaches, if you are a resident that lives north of the Narrabeen Bridge and east of the Baha Temple at Monavar Road, you cannot leave your area. You are still in lockdown. You can't accept anybody from outside your community, and I apologise for that, but we have to maintain a lockdown in that area with one exception. On the 24th, the 25th and 26th, you're allowed to have 5 people into your home, but they must be people from within that region. So if you live in Avalon, you can have 5 people into your home, but they must be residents north of the Narrabeen Bridge and east of the Baha Temple at Monavar Road. So for the people of the northern part of the northern beaches, you cannot, unfortunately, move outside of your community, outside of that boundary. You cannot accept anybody from outside that boundary into your boundary, but you can accept 5 people from within that community. So if you know you have a neighbour who's all their relatives live outside of that area, please consider being a good neighbour and perhaps spending that time with them. And then back on the 27th of December, we revert back to the current lockdown provisions where you can't unfortunately visit each other's homes. So for the next 3 days, you'll be able to visit homes up to 5 people at a time in that precinct, but they have to be people from that same region. We can't have anybody mingling with other parts of the northern beaches or in fact other parts of Greater Sydney. Now for the southern part of the Northern Beaches, so for people who might live in Manly or Wakehurst or Dee Why, on the 24th, 25th and 26th, you will be able to have 10 people into your home. However, you can't leave the area. You can have other people come in from the region or from other parts of Greater Sydney, but you yourself can't leave. We don't want people from the Northern Beaches mingling in other parts of Sydney at this stage, but you can welcome people in. Again, you can have up to 10 people into your home on the 24th, 25th and 26th, but you can also include children you can add children under 12 onto that number. And after that period of time, we will advise residents what the situation is in the southern part of the Northern Beaches. So we will be letting people know on Boxing Day what the 27th of December looks like for the southern part of the Northern Beaches. But essentially, you have the same lockdown conditions in the southern part of the Northern Beaches, with the exception that you can have 10 people into your home. Part of those 10 people can be from outside the Northern Beaches area. However, you cannot leave yourself, so you're still subject to essentially those 4 reasons why you can leave home. So whatever exists now for you is the same, but for people coming into your home, potentially from outside the area. Now, this is all based on health advice and the data we have. And the issue that we have, which concerns health, with Dr. Chant will talk about, is the fact that we still don't know how the virus got into the Avalon cluster. We don't know how the virus got into the community, and we want to make sure that there aren't strains or there aren't lines of community transmission that we haven't found yet. So can I please stress that for all of Greater Sydney, for all of the northern part of the Northern Beaches, we will revert back to existing conditions on the 27th of December, but the jury is out for the southern part of the Northern Beaches. For the precinct that's not that contentious, or that Avalon cluster, that concentration, the jury's out as to what happens on the 27th of December. But for the rest of us, we go back to what we have today. So I just want to make that position clear. Can I also stress that health's job is easiest when the Service New South Wales app is used. It's been apparent to us that whilst we've allowed businesses to use alternative apps, alternative QR codes, I should say, it's proving to be too frustrating for our contact tracers. Health has done an unbelievable job getting us to where we are. We've seen in other jurisdictions when there were 30 cases or more what the outcome was. To date, we haven't seen that trend in New South Wales. We've actually seen the reversal, and our health team has just been outstanding. We need to make their job easier. We've given businesses so much time to comply and to make sure the QR codes are in place, but we remain unsatisfied with the level of compliance for people who aren't using the Service New South Wales QR code. So by January 1, we want all hairdressers, all hospitality venues to be using the Service New South Wales app and the Service New South Wales QR system. So from the beginning of 2021, from the 1st of January, our expectation is that if your venue, if you're a business owner, you run a business, rather than using your own QR code, for those businesses that aren't using the Service New South Wales QR code, we want you to go back to the Service New South Wales QR code, because what that means is that if there is a case in your premises, our health people can get onto that immediately with accurate numbers, accurate contact details. We need to reduce the risk of being able to contact people quickly, because we know that every time you ease a restriction, every time you allow mobility when there is active cases in the community, that risk goes up. And one way we can combat that is by making sure our health people have as much information as possible when they are contact tracing. So from the 1st of January, our expectation is that all hospitality venues, plus hairdressers in particular, will have the Service New South Wales QR code. It takes about 2 minutes to download. And then our expectation is that around a week after that, that all other organisations and businesses who require record keeping also revert to the Service New South Wales QR code. This is part of our armoury in defending our community against the virus. It's part of our armoury in making sure we protect our citizens. Can I also make this final point? If you are a vulnerable family member, if you are concerned about the health and well-being of your extended family or your family, you may choose not to have anybody into your home. You may choose not to move anywhere. And of course, the less mobility there is, the less risk of the virus being transmitted throughout the community further. So whilst we appreciate the modest changes we've made over the next 3 days, we also accept and respect the fact that many families and many individuals may choose not to take up that opportunity because of the concerns they may have for vulnerable members of their family, or because they're worried about either acquiring the virus or contributing to the transmission. So we ask everybody to make those assessments. We're trying to be as flexible as we can under the circumstances over the next 3 days, but everybody will be reverting back to what we have now, except for the southern part of the northern beaches, and we'll make that assessment on Boxing Day and let people know on Boxing Day what the 27th of December looks like if you live in the southern part of the northern beaches. But for Greater Sydney and for those in the northern part of the northern beaches and for regional New South Wales, it's pretty simple. What we have today is what you'll have on the 27th of December. But for that southern part of the northern beaches, which we will see what the cases are doing, we will see what mobility has impacted, because obviously when we welcome people from other parts of Greater Sydney into that community, there's always a risk there, and we have to assess that risk before we can say what the 27th of December looks like for those people who live in the southern part of the northern beaches. I'll now ask Dr. Chant to provide her health update. Minister Hazzard will then reinforce some of the facts I've spoken about now, and then we'll be pleased to take any of your questions. Thank you.
Thank you, Premier. So of the 16 new cases to 8 p.m. last night, 8 cases are locally acquired, and of these, 7 cases are linked to the Avalon cluster, and 1 is a close contact of a known case whose source was under investigation. So yesterday we alerted the community to this case. This is the contact of the healthcare worker that transports patients. What I can confirm is that genome sequencing has indicated that this person did not acquire their infection through transporting the patients that had the COVID-19 infection on the 14th of December. In fact, this sequencing shows that it's linked to the Avalon cluster. Now, we do not know how this is linked to the Avalon cluster at this stage. And can I just extend my appreciation to the people involved in this for actually receiving many calls yesterday to clarify, have you been here, have you known this person? But to date, we have not established those connections, but certainly the epidemiological sequencing of the virus shows that it is linked to the Avalon cluster and linked to some particular people within the Avalon cluster, and we're trying to investigate those missing links of how that transmission occurred. In relation to Central Coast residents are being asked to get tested if they even have the mildest of COVID symptoms. I mean, that message goes for us across the state, but that's because the state sewage surveillance program has detected traces of the virus at the treatment plant in Kincumber, serving the Gosford area on Monday the 21st of December. The sewage system includes the suburbs of Avoca Beach, Carryong, Point Clare, Tascott, Summersby, Narara, Lizarro, Wyoming, Springfield, Greenpoint, Erina, Kincumber, Terrigal, Warrambul, Saratoga, Bensville, Kilcare, Davison, McMaster's Beach, Copacabana, Yakulaluga, Gosford and Budai, in which around 140,000 people reside. We are aware that there is a COVID positive case in the Central Coast, as well as a case from Western Sydney who visited Avoca whilst infectious last weekend. So there is an explanation for this, but we want to take a very cautious approach. We are making the public aware of this in the Central Coast, so please be on high alert and please get tested if you've got the most minimal of symptoms. Also, I'd like to note that we have had a case in a Qantas staff member who has returned from overseas and flown in through Darwin. And the person has flown on a domestic flight. There were a number of precautions in place, but there will be a limited number of people on the flight. So that was a Qantas flight departing Darwin to Sydney on the 18th of December. This news has just come through, so we don't have the flight details and any other details, but we wanted to advise you of that. The other thing I would like to say is just thank you for the testing levels. They have been amazing, and it's also pleasing to see the testing levels go up in the areas we're concerned about and in the vicinity of those venues. So thank you very much for taking that action. I would like to just highlight a couple of other venues. So COVID infection has been confirmed in a person who ate at the Paddington Alimentary, and I encourage all diners there from the 17th to the 19th to remain in isolation, get tested again if symptoms arise for any, and for takeaway customers to get tested should the slightest of symptoms develop. So anyone who was at that venue, we'd already for a few days indicated they were close contacts. I've called that venue out in previous press conferences because of our concern that transmission might occur in that, and this is outside the numbers. This is an overnight case. We have had a transmission. I'm just alerting people to be particularly vigilant. Make sure if you've eaten there, you're in a close contact, you need to be in isolation and get tested. In terms of the Rose of the Australia Hotel in Erskineville, there have been 2 cases associated with the Rose of Australia Hotel in Erskineville. One dined on Tuesday the 15th of December whilst infectious, and another diner tested positive on Sunday the 20th. So that's a venue where we believe that there were transmission event. We will continue to update you because I think it's important that the community knows where we may have transmission events. I acknowledge there is a large list of venues, but I do urge people to continually refresh their view of that website, the New South Wales Government website, keep up to date. I also stress that the information might change. And information changes because when we interview cases that have just come in, they've often been at some of the same venues. So for instance, a person that visited the venue on this day, if we've had transmission, the new case may well have returned to that venue on a different date. So there is often different dates that are popping up, and also sometimes we end up expanding the range of time that an individual was there. Often people's recollections are less, and we often take a conservative approach, but new information might come up where we actually expand the area of concern, again taking a cautionary approach. So could I ask the community to really bear with us? It is a movable feast. We're trying to get the information out there as rapidly as possible, but it does change. Thank you very much.
Thank you, Kerry. Look, can I just start off by saying that I want to thank the Northern Beaches residents who've come out in huge numbers in the last few days to be tested. I implore my fellow Northern Beaches residents to keep coming out and getting tested, despite the fact that we're moving into Christmas Eve and Christmas and Boxing Day. We need you to get that information to our tracers, to our frontline health staff, to be able to make certain as to what the level of transmission is on the Northern Beaches, whether it's the northern zone or the southern zone of the Northern Beaches. Can I also say more broadly, clearly the opportunity for visitors, albeit very limited, in the northern area and the southern area of the Northern Beaches does clearly increase some risks. So I would say that while we are trying to strike the balance between the population health risk and individuals, it does come down to the individuals in the end to make their own decisions on whether they're going to have people come into their homes, particularly in those 2 areas. I would say that anybody who is over the age of about 70 or anybody with other health issues, comorbidities, should think very seriously about whether or not they have people into their homes. But if they do, try and do it outside in the fresh air, perhaps on a balcony, perhaps outside somewhere, so that you minimise the risks. I also want to add on the QR codes, I made some comments a few days ago about some of the stupidity that we're seeing with people using dopey names like Donald Duck and Mickey Mouse. But one of the issues around the QR codes that is very concerning is that even facilities, cafes and restaurants across obviously the rest of Sydney, obviously not on the Northern Beaches at the moment where they're closed, but in other parts of Sydney and indeed across New South Wales, is that the proprietors of the businesses are not necessarily being as careful in ensuring those who come into their business actually do fulfil filling out the QR code. Before somebody in a coffee shop serves a coffee, it should be the QR code they're checking. They need to remind people who are visiting their restaurant or their cafe that you need to fill out the QR code. There's a certain flippancy in the way some businesses deal with this. Putting a sticker on the table and expecting people to remember that is just not on in the middle of a pandemic. So as Health Minister, I'm saying to those businesses, we want to support you, but you have to support us and the tracers, the health tracers, by ensuring that when you have a visitor to your cafe or your restaurant or anybody else that's got a QR code, make sure they are filled out. It's useless to have them sitting there unless you get the necessary information. That's all I really want to add at this stage. Thank you.
Can I ask you about aged care facilities? So what's the rule for inside the Northern Beaches, what's the rule for Greater Sydney, and what's the rule for regional New South Wales? And is the rule or is the request?
Okay, so in terms of the aged care facilities in the northern end of the Northern Beaches, we're really saying please don't visit aged care facilities. The risk is too high. There will be exceptions in all cases where someone may be at end of life, and so we need to take a pragmatic view. In terms of the southern end, again, the most cautious approach is not to have visitors in that area. We will be releasing some guidance to aged care facilities, but basically outside the regional areas, we want to actually allow visitors into aged care facilities. What we're suggesting is that you're cautious about not having people who have travelled into the Northern Beaches or into any hotspots, and you've got that really good screening in place. And also generally in Sydney, just to be very cautious and limit visitor numbers, have escorted visitors. Now, we do understand that, so anyone where it is non-essential for you to visit your loved ones, please understand that the nursing homes are going to have to put in a lot of additional controls to allow that to happen. So can we please be patient, and if it is not as a significant event for you at that time as others and you can delay it, then please do, because we are trying to allow some flexibility. We're working with the aged care sector now, and I'll be releasing that result, more detailed, coherent advice once we've had some input from the aged care sector.
What about residents leaving aged care shutdown?
So again, what we will be doing is issuing advice. It will differ depending on your particular circumstances, but certainly in rural areas, leaving aged care facilities into households, provided those households don't contain close contacts who should be in isolation, or also that they're not containing people that have come from high-risk areas. Can I just stress that our guidance about when you can have visitors does not mean that if you have been designated as a close contact, you need to be in isolation. And what isolation means is being in a room, going out for exercise, but not coming into contact with anyone. You can go out into your backyard, but there are guidelines on the website, and isolation means what it sounds like, isolation.
Premier,
Well, please note that what we're advocating over the next few days is very modest, and we need to consider a number of factors. A number of people on the Northern Beaches have been in lockdown now for a considerable amount of days and not been in contact with anybody. We also have to assess the risk across the state. We have done reasonably well in getting the numbers down to what they are. We've also done reasonably well. I mean, our genomics team have been outstanding in finding some of the links, and that has given us some degree of comfort. But please note that what we're putting forward are very modest changes. Children under 12 have proven not to be carriers or transmitters of the disease, which is the only difference we're making to Greater Sydney, is that you can add children under 12 onto the 10, but that reverts back to normal on the 27th. And in fact, we're perhaps isolating further the Northern Beaches community by the northern bit, because those community members now can't travel further south to other parts of the Northern Beaches. We're asking them to stay in the north of the Northern Beaches unless they fit into one of the 4 categories of work, education, or the existing system. So in some ways, some of the measures are actually stricter than what we have today, but what we've done is make sure that we're assessing the risks. So the risk to Greater Sydney is different to the risk in the northern part of the Northern Beaches, and also the risk in the southern part of the Northern Beaches is different as well. So please note that what we're putting forward is very modest. and it's based, and this risk is assessed against what the best data is telling us, what the best advice is telling us, and where we think things are at. If something suddenly changes, and in fact, one of the last things I said to Dr. Chant just before we started this press conference is that if something comes out of the blue that's not expected, if something happens we don't anticipate, things can change. This is an evolving situation. But what we want to do is try and provide as much certainty as possible for the next 3 days. And then on the 27th, everybody reverts back to what we have today. And can I make that clear? Except for a question mark over that southern zone in the Northern Beaches, and we'll assess what happens there in the next 3 days. But can I be very clear that whatever we have in place today goes back on the 27th, and in between they're very modest tweaks and modest changes to account for the fact that everybody has had a very difficult year. Some people's stress levels and mental health capacity is already at breaking point, and we want to try and put that against the current risks as we see them. If the numbers were trending another way, if we had the case numbers we had a few days ago and the trend wasn't where it was, and the cases weren't all linked to the Avalon cluster in the main, well then what we'd be saying today would be very different. But I want to be very clear that what we're putting forward is very modest. And I also say to everybody, as has Dr. Chant and the Minister for Health, you have to assess yourself what this means for you. You may feel uncomfortable in going somewhere or welcoming someone to your home, and everybody has to make that assessment. The last thing any of us want to do is inadvertently give the disease to those closest and dearest to us. And I please ask everybody to think about that. And also to please think about, if you are out and about attending a venue, please make sure if a venue you're attending doesn't have good systems in place, there isn't hand sanitizer, the QR code system isn't up to scratch, please go back home. We don't want anybody risking the spread of the disease and then us not even being able to contact people at a venue. And I say to all the businesses who've done the right thing, thank you very much. But we want to see greater compliance across the board. There is a bit of difference in those businesses doing the right thing and those that aren't. So again, it comes down to all of us doing what we've been doing for several months, and especially the last week. I've been so buoyed and truly humbled and amazed by the way in which the community has responded to what we've asked them to do. The testing numbers have been so pleasing. The way in which the Northern Beaches community in particular has responded has been very positive. So I just say, can everybody please also consider what we're allowing is the outer limit, but please consider what is in the best interest of you and your family. Well, it's more about stretching what we think is appropriate at this time, and we're not prepared to take any further steps than what I've outlined, because we think, I'll get to everybody, don't worry. We just think the risk is too great to go any further than what we have. And on the 27th, we want everybody to revert back to what we have today, but for a question mark over that southern zone in the Northern Beaches, which will provide information on Boxing Day. Well, the logic is obviously by not moving out of your region, you're reducing the mingling, but also remember there aren't hospitality venues and other events happening in the southern zone of the Northern Beaches. So we don't want anyone from that southern zone going to a hospitality event, say outside of that Northern Beaches community. So this is to mitigate against spread in larger venues where there could be more people. So we thought about the logic of this to a large extent, and we came to the conclusion with the advice of health that we want to reduce the chance of a venue outside of the Northern Beaches having a case there which then spreads, which is why we've done what we have. And we also want to keep an open mind, but again, many people may decide not to enter the Northern Beaches. If you're over 70, you should think twice about that. We're trying to be as I guess generous as we can, but we can't be any more generous than what we've done. They're modest tweaks over the next 3 days. We're trying to take everything into consideration, but the risks are still there. If you're a vulnerable person, if you have a comorbidity, if you're over 70 years of age, you should think twice about going into the Northern Beaches area. But in relation to a number of factors, given the southern zone, the southern part of the Northern Beaches has been very different. I mean, some parts of Sydney, if you look at some of the cases that have been around Turramurra and around the Erskineville pub and other places, some of those areas are as risky as the southern part of the Northern Beaches, which is why we've made the assessment we have. And we also want to reduce the chance of having any spread at a venue outside of the Northern Beaches, because we've seen that already happen. So by limiting the Northern Beaches people from going out, by at least allowing them to have some members of their family into the region, that mitigates the risk of exposure at venues outside the Northern Beaches. I'm sorry? There are no, whatever is in place now remains in place. Whatever, well, it's publicly available information.
There's different ways of counting it, but the key issue is we haven't found a link, and because there's a missing link, they can't be linked to the cluster, but we would talk about them being genomically linked, but there is a missing link, and that missing link causes us concern when we don't know how that acquisition occurred. Now, based on this data just came, some additional information came through at 9 o'clock this morning, so the teams will pursue a number of other lines of inquiry that new genomic sequencing data has led to, and we will continue to try and find those links. As you're aware, when we have this perfect linkage, it means that we have less risk that there are those undetected cases. Some other states have referred to them as mystery cases. We tend to use unlinked cases, locally acquired, and they're the ones that cause us particular concern, because it means that there's been people out in the community potentially going to a number of exposure venues for which we are currently unaware.
And Dr. Turner, would that person be linked to patient zero then if they haven't actually been to the Avalon area?
Yes, obviously our investigations are ongoing, and let me tell you, we would have probably predicted that the likelihood in this case was that this transport worker actually acquired it through transporting an infectious patient. And I think I said to you at the time, we've got to keep an open mind, and can I thank the genomic sequencing people who have been up working, I think, for the last 7 days, all through the night. And every time I keep on changing my request to this one now is a priority, I thank them and call them, can they make it quicker? But this highlights the fact that how important that genome sequencing is, because we would have been pursuing one line of inquiry, and this really narrows the line of inquiry to a different issue, because the strain in the US returned travellers is very different from this strain. That's right. They have a role in patient transport, and that's why we were talking yesterday about the fact that there was this possibility that the person was infected, because we know they had transported on the 14th of December. What this shows is, like all things in COVID, it's important to keep an open mind, because what it's shown is, despite that sort of strong face value history, that was not how they acquired their infection. How they acquired their infection is yet to be determined. That person's case is closest to the Avalon cluster cases, and we're obviously investigating the connection. At this point, we have not got a perfect connection, but with some additional genomic sequencing data, we'll be pursuing another number of other additional avenues. And can I thank the individuals that I really genuinely want to say this. We are ringing them multiple times a day to clarify minutiae of their lives and who they've interacted with in order to help us solve this puzzle. So thank you. I think, as the Premier has said, what we're balancing is balancing risks, balancing COVID risks, balancing mental health risks, balancing community well-being. I've had, whilst we give, advice about perfectly what is the best thing for COVID, we have to balance multiple dimensions of that. But also we know that it's important that the community is with us on the journey. And I'm not going to release these numbers, but I've just seen the text, because we're monitoring testing numbers all the time, and it's come through. And can I just say, I think you're going to be stunned by the level of testing that we report today. And that really shows that the community is coming out in force. It is important that we get, whilst we have contacted by the text messaging all the people we've had valid numbers for, we will be working really very hard today to get everyone on those venue lists contacted. We had been focusing particularly on venue lists outside the northern beaches, but we will be pushing hard into all the northern beaches venue lists as well today.
Dr. Chan, on the Qantas worker.
Sorry. So, no, they don't live in the northern beaches. They live in an unrelated, and that's why the concern. We wouldn't be as concerned if they were lived in the northern beaches, because we were expecting that there is some community transmission in the northern beaches. We have had a couple of cases that haven't been specifically to contact venues, but have been basically out shopping and into those communities in the northern beaches area, the northern area. So we know that there was some community transmission in that area. Sorry, could I just...
Were they tested when they arrived?
Look, this person flew into Darwin. We'll be working with our colleagues in the Northern Territory Health Department. I'm just giving you this news, which is just very recent in its origin in terms of those details, and so we're happy to be give some further details as they come to hand, particularly around any contact tracing we may need to do in relation to the flight, and we'll be liaising with our Northern Territory colleagues. So just to be clear, in New South Wales, no flight crew, the new changes to the flight crew requirements ensure that even though pilots are still pilots and other flight crew are allowed to isolate, self-isolate in the homes, in New South Wales they are required to have a swab. They're required to comply with a strict set of requirements outlined by the Chief Health Officer, and they can only on-fly or move anywhere in an empty plane. So they are able to operationally reposition the crew, but the crew need to be transported on an empty plane, not a domestic plane.
Is it the same in the Northern Territory?
There are different arrangements in different states and territories. Well, there's been a number of venue exposures, so I think over the days I've indicated there were a case linked to the Rose, there's a case linked to the Delhi, so they will be scattered around New South Wales, and they will have been from those venues. So, for instance, in the Turramurra, I've mentioned the cluster relating there. That's been a person that's come out from a venue in the Northern Beaches, gone back and gone into a workplace, and there's been a workplace cluster there. Can I just say, at the moment, what we would reframe that question as, we have not found how the source entered Northern Beaches. We're investigating a range of options, and they include hotel quarantine, they include keeping a very open mind of all other ways international at our international borders. Look, at this moment, we are obviously considering all of the possible avenues and exploring them. And as I said, with all this new information, it generates further lines of inquiry. And please be assured that no one wants to get to the bottom of this, probably more than myself.
Last questions, please.
Obviously, that is a concern. What we're most concerned about is, obviously, if we have these high rates of testing, the longer we get, it gives us a little bit more assurance that there weren't chains of transmission established by those missing links. And that is why we need the community across New South Wales to come forward for testing. This is our best insurance policy, that we're not missing undetected transmission. And we will also be watching closely the sewage surveillance, which is also our other early warning indicator.
Well, in relation to returning Australians, no state at the moment discriminates against taking residents from other states. I mean, that doesn't occur anywhere. So you could very well have a New South Wales resident flying into Brisbane, or you could have a New South Wales resident flying into Perth. So those arrangements that are in place in New South Wales happen everywhere across Australia. The biggest difference is we carry more of the burden. We do more of the heavy lifting. And that's why I've been saying for months and months for our state colleagues to share the load. And on the first part of the question, I'll have to ask Dr. Chan, which was, I'll just have to ask Dr. Chan.
That person was resident in New South Wales, but can I also just say, I've been very clear as well that it may not be at all related to that traveller. I've been very open that that's one match that we've found in the genome sequencing, but there are lots of unknowns. There may be other people that have come into the country through whatever means that may have the same strain. So I think it's really important that in these investigations we don't jump to conclusions. I think that patient transport case gives an absolute example. If I had surveyed all of the public health clinicians, they would have thought it was most likely associated with the transport of an infectious patient, but this now is linked to the Avalon cluster, and I think this highlights the fact that we need to keep an open mind as we diligently pursue these investigations.
Last one, please. Last one, please. No one would begrudge you a holiday. I believe you penciled in today as your last day for a...
Oh, I had, but I've pushed it back further, so I'm hoping to take some time off in early January.
So Christmas has been cancelled for you?
Well, no, I'm still hoping to get to my parents at a safe distance because I do worry about them. They're both in their 80s, but I'm hoping to see them during the day, of course. But I will be, I'll be working up until early January.
Can I just ask you, just to clarify, travel, you still have your complete Greater Sydney, obviously not the Greater Sydney, to go and visit family and regional areas?
We are, but we're just asking everybody to be careful. So whilst we're still allowing that level of mobility through regional New South Wales, we just need everybody to be careful. And remember what we said, if you are a resident of the Northern Beaches and you left the Northern Beaches after the 10th of December, you should treat yourself as being in isolation or in lockdown if you're in any part of New South Wales, including Greater Sydney. So if you've gone to stay with relatives and you left the Northern Beaches after the 10th of December, you shouldn't be moving around. We expect you to have stayed in your spot and acted as though you were living in the Northern Beaches. So whilst we're not restricting any mobility between Greater Sydney and the regions, we're just asking everybody to be extra cautious, extra careful. Please wear masks in indoor settings when you're going grocery shopping. Public transport obviously won't be used as much over the next few days, and that's the other issue which gave us some level of comfort in the tweaks over the Christmas period. There's far less mobility because people aren't at work or at school, so ordinarily you have less movement anyway. But what is most critical to us is that everybody tries to protect those closest and dearest to them by being sensible about the next few days. And of course on the 27th we all revert back to what we have now, except we will come back to the